not many really understand how postpartum depression can affect a new mom. So we've invited a clinical psychologist to shed light on this condition.
Dr. Violeta Bautista, who is also known as Doc Bollet, is the founder-president of Care and Counsel Wholeness Center. Her approach to therapy is known as the wellness approach, and she is also the head of the clinical psychology of UP Diliman. Hi, Doc Bollet!
Hi!
Hi,
Nice to have you
Cheska
with us.
and Rika.
Yeah, hi Doc Bollet. So Doc Bollet, we'll be talking about postpartum depression. What is postpartum depression?
Well, postpartum depression is a kind of major clinical depression. In the Diagnostic Statistical Manual, that is... don't worry, I'll explain.
Okay.
It identifies postpartum depression in a different name. It's referred to as peripartum depression.
Peripartum
Yes,
depression.
it's the kind of depression that takes place either during pregnancy or immediately after pregnancy.
Okay.
You are sad, feeling hopeless, feeling down almost all the time. And the things that you used to enjoy, you don't seem to be interested in anymore, okay? Your ability to absorb, concentrate, focus on tasks on hand seems to be lessened. There's change in your sleep patterns, either tulog ng tulog o ayaw matulog. And then your self-esteem is shot. You think you're no good, you're not doing well as a mom, you're not going to bring up your kids well. You could even entertain thoughts of committing suicide.
What about that? I've read about it that when she looks at her baby, she's angry at her baby. Is that part of it?
It can be, or it could just be one short reaction. It happened to me. When I saw my newborn baby, I said, oh my goodness, she looks like my mother-in-law. And during that time, I wasn't doing well with my mother-in-law. But eventually, we're okay.
You're
we
okay
lived
now,
a
yeah.
harmonious life.
How can we really diagnose? Like, do we go to a clinic when we have all 5 of these symptoms?
Those are telltale signs.
Okay.
But you're not sure. Maybe you're just being so concerned.
Yeah.
Yes.
Maybe it's just the baby blues. So you consult a professional.
Consult a professional.
Yes.
Can you tell your
That's
OB-GYN first about it?
You could, because one reminder to us when we are going through major changes in life, and having a baby is a major change,
Yes.
is to be open and let people come into your life so you could share. And if there's anything unusual, then people who are in the know, those who have had so many babies
Right.
before, can tell us, naku Rika, ganyan lang yan.
Oh, yeah.
Oo,
That's so
how-
comforting.
Yes, but if it
Yes.
persists for more than 2 weeks, and the impact is very strong, it gets
Right.
in the way of happiness, then maybe you have to take note and bring them to a
A professional. Okay. But is there a way to prevent it? Because some women, di ba nga, wala. Like kami ni Cheska, we didn't really go through it. Was there something that we did probably that helped us to not go through it?
Let me share some of the things that mothers, infanticipating mothers,
Okay.
can be mindful of. Maybe we could think in terms of 4 or 5 S's.
Okay.
Okay, it's good to remember when you have these acronyms.
Very good way to
okay?
recall this. O, sige,
So,
may test tayo
well,
mamaya, Cheka.
One S is self-care.
Self-care.
You know, when you're going through this normal, exciting experience of pregnancy, take care of yourself.
Okay.
Have regular hours of sleep, okay? Exercise,
Yes.
eat nutritious foods, keep a positive mind,
Positive mind, yes.
Yes, very important because women tend not to take care of themselves. We tend to take care of others. And we
Yes.
tend to think maybe I'm going to be selfish if I attend to myself. No. Self-care is important for all women, especially
I'll
for
write that,
pregnant women.
Self-care.
Notes na po siya.
I need to.
That is
Alaga.
true. We
Oo,
need this.
alaga sa sarili. Come to think of it, who takes care of mothers? There are people who take care of babies. Husbands say, thank God for my wife who takes care of me. But who takes care of mothers?
Mothers.
Kaya kailangan self-care.
Self-care.
2S is self-monitoring.
Self-monitoring.
So you observe yourself, without being paranoid or obsessive about it. Just how am I going through life now that I'm pregnant? What are my reactions like? Am I going through this period in a happy way? Or are there things happening within me and around me that doesn't seem to be healthy and happy? And so if your self-monitoring scheme tells you, no, it's negative, then you have to do something about it. So that's 2. The third one is share, okay?
Share.
Yeah.
Talk about it.
So the best things in life is having friends
That's true.
Yeah.
and relatives to be open to,
Tama.
to share your experience with.
And siguro,
Okay.
Doktora, what our viewers can remember, not only to your friends and relatives, most especially to your partner. Kasi yan ang katabi mo. He's the person that you're with 24/7, that you share intimate moments with. So you should be able to tell him.
Ang galing naman ni Cheska.
Ay, sabi niya, ay,
Why would we forget to share with our partners?
That is true.
Wherein they should be our best friend.
Exactly.
Tama.
And the mother sharing with the prospective father about her experiences help prepare the father. So 4th would be seek skills and knowledge. There's no school naman where we learn about how to be a new mother. We buy books, we log into the internet, we ask people to teach us what are the characteristics of babies,
Right.
and how am I going to take care of myself, of my baby when she or he comes out. And then, of course, the last S is stress manage. So we identify what stressors can be eliminated, what stressors can be moderated,
Right.
what stressors can be postponed. I'm not going to deal with that right now. And what stressors just need to be accepted. It's just a part of my life. I just left it up to God.
if there are dads or husbands watching us right now, what can they do to support a pregnant woman or a woman who's going through PPD?
Our partners are our helpmates. So they are our primary source of support. Okay? So the best way to support is to make the person happy. Because people who are happy, it's like they've had a shot of vaccines that inoculates them from the negativities of life. So be naturally, wholesomely yourself. Be attentive to the needs of your wife because she may be experiencing some new things. So it's good to draw them out.
So I guess men, be sensitive when you have a wife who just gave birth and who looks sad all the time, di ba? A little sensitivity goes a long, long way. That's for the husbands, right? But Doc, earlier you were telling me that actually dads also get PPD. Is this right?
Oh yes, most definitely.
How?
So, yeah, fathers and not only mothers can experience PDD.
You mean they have the same signs?
Oh yeah.
Like they get sad, they
They-
don't get to do normal tasks anymore?
They get clinically depressed.
Because,
What
for
are the common
reason?
reasons?
Oo.
Well, I guess the same when you have less social support, when you were not prepared for the marriage and for the pregnancy, when the delivery has been difficult, even traumatic, the mother's health as well as the baby's life has been compromised, when there had been a series of miscarriages.
Just goes back to what Cheska was saying earlier, that they share kasi, they share the same thing. It's actually not just solely the woman's part to have a baby, but the whole change includes kasi din the husband. Oo nga
Yes.
naman.
What a beautiful thing to remind our viewers. Pregnancy is a normal experience.
Oh, yes.
Secondly, it's normally a joyful experience. And thirdly, I like what you said a while ago when we were chit-chatting,
Yeah.
that pregnancy is a shared experience. You know, we tend to think, a pregnancy is just the experience of the mother. No, it is not. It should not be. It's the husband and the wife who
Right.
made the baby.
Exactly.
And they're both expecting and watching over the growth of the baby inside the mother's womb.
We're talking about women who have husbands or partners, but how about those who don't have, for whatever reason it may be?
Okay, it's good that you mentioned that because studies have shown that compared to women with partners, there are more single mothers, single parenting mothers who are experiencing PPD. So, of course, there's less social support, there could be a stigma that they're worrying about. So, they need expression of support from our community. Okay, we need to visit them, inquire on how they are doing.
Ako, thank you, Doc. You know, I'm sure kami pa ni Cheka, we want you to stay.
Madami pa kami questions.
Answer all of our questions, but thank you for being here.
Well, I
Thank
enjoyed
you.
this conversation. Very real and very intelligent.
Thank you, thank you.